Alrighty, so we are going to tape an ankle. So the reason to tape an ankle is for ankle support post-injury, to support chronically weak ankles and then prevent inversion, which would be the ankle going inwards. First, you want to make sure that the ankle is clean and dry, that there is no wounds and no jewelry. So, no wounds, no jewelry, perfect. We want to make sure that the ankle is in 90 degree, not floppy, not wackadoo, right? 90 degrees. So, the materials we are going to be using today is 1.5 inch tape, just like this, some pre-wrap, and then just for the teach, we are going to use green on one step. And then, before taping an ankle, you're going to spray it with adhesive, and then you would stick these little pads on. These are to limit friction, so it would go right here and then right on the back. Limit friction, and it just makes it a little bit more comfortable for the athlete. So first we are going to start off with pre-wrap. We want to go right below the calf belly, and then a dog ear to prevent the pre-wrap from going down and falling. And this step doesn't have to look pretty because it is just a barrier between hair and the skin in case an athlete has a latex allergy. Next, we are going to do 3 anchors. So for these anchors, you're going to start at the top and work your way down. These anchors, you want them to form a peak and not just straight across. And then you also want them to slightly cross over each other. Overlap this way and then also this way. And then we are also going to do an anchor at the base of the 5th metatarsal, so you'll be able to feel like a little bump. That is where that would be. And then again, you want to make a peak just slightly going upwards at the base of that 5th metatarsal. Now it is time for stirrups and horseshoes. Again, these help to support ankle, not invert. And then with these, it is important to do them medial to lateral. So inside to outside. All right, and then we're going to do 3 of these. Last one of each. And then our last horseshoe. And then the next step after that is going to be a heel lock. So I will show you in green tape. For this step, it's important to start and stop in the same spot. So you're going to we're starting on the lateral side. We're going to swing to the medial side of the heel, wrapping around just the outside of it and stopping in the same spot. And then this would only be half a heel lock. We are going to do the same thing on the other side. Wrapping just around that heel, starting and stopping at the same spot. And then you can also do it continuously as well. So that would be our 2 heel locks. After this, it is time to close up the wrap. So now we are just going to wrap it up. It doesn't matter if it's medial to lateral, but it does matter going distal to proximal. This makes it to where you do not cut off blood circulation. It pushes the blood up, and then also it's important to not do one continuous strand because that will lead to cutting off blood circulation. And then one last one to secure the bottom of the base of the 5th metatarsal. So now that you're done taping your athlete, you're going to check for windows. So window would be a spot where you can see skin. The heel doesn't matter, but there are no windows. You want to keep wrinkles to a minimum. And then also you want to check for like the appropriate tightness. So you're going to do a capillary bed refill. So that's just squeezing the toe, or if you're wrapping a wrist, it would be fingers to check the blood circulation. And then also to take the brace off, you will either use blunted scissors cutting away from the patient, or a shark, which is just a blade and you cut down and away. So that is taping an ankle.